You know, looking ahead, February is Heart Month, and it is also time to go red for women. And this morning, our daytime cardiology specialist, Dr. Shobha, is here to talk a little heart health with us this morning, especially when it comes to women. Because, you know, we all have heart, you know, we all need good heart health. But let's talk about, there's some differences when, you know, we were talking the other day, I was talking to a friend of mine, there's differences of, you know, if there's a heart pain, or there's something presenting, it's different sometimes in men and women, isn't it?
Yes, that is correct.
Yeah.
You know, heart disease is the #1 killer,
right?
Whether it is a man or a woman,
right?
And I think people forget that. And so, you know, women sometimes try to blame their symptoms on different things. You know, they're overworked, they're tired, it's their hormones. You know, they always try to push off their symptoms a little bit. #1, they may not even pay attention to their symptoms. They try to hide their symptoms. And so they tend to present a little later than men.
What advice do you give for women to get past that?
I think, you know, being aware that you're at risk for heart disease and raising public awareness for that is extremely important. And be it a man or a woman, you know, you need to look for your risk factors. For example, do you have a family history of heart disease? Do you have diabetes? Is your cholesterol been checked? Do you smoke? Are you not exercising? You know, like you just talked about exercise. And so some of these risk factors, if you have these risk factors and you start having symptoms, and you know, a man may present with classic chest pain, neck pain, left arm pain, but a woman could just present with getting more fatigued, more short of breath, you know, ache in the back between the shoulder blades. You know, just getting sweaty.
You feel something out of normal. You need to get it checked.
You need to listen to your body. That's correct.
Do you say go immediately? I mean, go to the ER, go to your doctor and say, listen, this is going on. It's time to get some help, isn't it?
That is correct. If you identify that you have risk factors, I think the first step is to make an appointment with your primary care provider and say, you know, let me get checked out. Let me see if I already have buildup of blocked arteries or if I have other types of heart disease. And if you start having symptoms, yes, the urgency ramps up. If symptoms are presenting suddenly, yes, you need to call 911. Don't drive yourself. You know, you need to go to the emergency room right away and get checked out.
What advice, I mean, we just came through the holidays and the New Year's come through, and you know, it's kind of a stressful time for a lot of people. And that stress can also elevate your level.
Oh, absolutely. You know, stress can cause heart attacks, and in fact, it causes more heart attacks in women than in men. And we call that broken heart syndrome, or Takotsubo, you know, where suddenly a woman, you know, is not able to bear with the emotional stress, and it causes a massive heart attack. But the good news is those types of heart attacks do not permanently damage the heart. Most often, women will recover. The heart muscle pumping function, you know, may drop. But then it may drop down to 20%, you know, from being a normal of, say, 60%. But then after about a few months, it's completely back to normal. And what helps women heal more, not only is diet and lifestyle changes and medications, but family support and ways to cope with stress, and the heart muscle becomes completely normal again.
You know, we talked about February and the Go Red for Women event happening this time of the year, but you know, this is something we need to keep in the back of our mind year round, isn't it?
That is correct. And what the American Heart Association, you know, they call that wear red in February. But you know, February 1st everybody wears red, but it's not just about wearing red. It's about making a determination for a positive change. Because I tell you, every body part affects your heart. You keep your mind peaceful, you lose weight, you control your sugars, your cholesterol, your joints are also happy for you. You know, you control your sleep apnea, you breathe better. So, you know, there are a lot of, so in trying to heal your heart, you heal your whole body. You're actually nicer to your family, you're nicer at the office, you get along well with people. So in doing all these things, you're helping your heart. So, you know, take care of your heart from your heart. Take care of the heart, of your, you know, of your loved ones from your heart. So whatever you do it from your heart. So it sustains. And like she said, make small goals. I want to wake up this morning, I want to make somebody smile. That's good for your heart. You know, I'll exercise for 1 minute today. That's good for your heart. You see, instead of telling your husband, you know what, you do the dishes or you put the garbage out, you know, let's do it together. We'll burn a calorie between us. You know, we'll both be healthy. You know, it's in the way you project yourself. All these small things build and help your heart, build your community, build your families.
Happy heart means a happy life.
Absolutely.
All right, Dr. Shobha, thank you so much.
Thank you.
We've got a number right there at the bottom of the screen. Take everything she said to heart today.